Venice Hospital in Haiti. And this is where we have a clubfoot clinic in here where they use the MD orthopedic braces. Come with me, let's go see. We're going to go visit some kids in the clubfoot clinic today and see how they're getting along with the braces we make back in Wayland, Iowa.
He is the chief orthopedic surgeon in Haiti, in charge of the clubfoot. Thanks to John, we have the brace. Thanks to Dr. Alexi, we have the expertise to be able to apply the brace, and we're grateful for this opportunity in Haiti that's taking place here. But what's important for us now is we're taking a TV show in Creole that will be able to be broadcast over 100 stations in Haiti. Millions of patients will watch this. We're making awareness of the clubfoot procedure because a lot of people have clubfoot in Haiti. They don't know this is available. So we're going to let the Haitian community know, and they're going to be able to call Dr. Alexi, and he's going to be able to give them a location near them.
This part of La Piste camp in Port-au-Prince was set up nearly 5 years ago to provide free basic housing to some of those who were disabled in the 2010 earthquake. Jean-Baptiste is one of them. He was working in a shop when the quake struck. As he was trying to get out, a wall collapsed, trapping his leg, which later had to be amputated. He and his 4 children now struggle to survive.
Because of my amputated leg, even though I'd like to go to work, I can't. Sometimes people give me some food for the kids, but sometimes they can go for days without eating.
The houses are basic plywood structures that are now 5 years old, with no running water or electricity. But Jean-Baptiste says things could be worse.
I'm happy that I have a house, even though I don't have the means to live on. I'm hungry and there are other difficulties for me and the kids, but I'm very happy to have the house because if I didn't, we'd be living on the streets.
An estimated 4,000 people lost limbs in the earthquake. Such a large number of new amputees has changed attitudes here, according to the director of the local branch of the charity Handicap International.
It made people realize that this could happen to anyone. The earthquake affected all levels of society, so everyone recognized that all of a sudden, a mishap like an earthquake or a car accident could make someone an amputee and affect a whole family.
Et provoquer le malheur de toute une famille.
Skillfully moving on their crutches, Haiti's Zarian soccer team brings a message of hope and resilience to a country still devastated by last year's massive earthquake. The team, wearing blue, is made up of 23 all-amputee players, 17 of whom lost their limbs during the 7-magnitude quake. On Monday, they faced off against Haiti's national amputee soccer team in Port-au-Prince before a stadium of enthusiastic fans. The Zarian players received treatment, athletic training, and prosthetic limbs, thanks to $1 million donated by aid organizations benefiting the program.
It's my honor to be able to come and meet this gentleman who works every day with the babies. And I thank God that he is here to help his countrymen and all the children that he serves.
Haiti's resources were overwhelmed by the influx of new amputees after the earthquake, and there's still a great need for prosthetic limb technicians and other experts. James is learning the skills needed to help amputees walk again. He himself lost a leg in the quake, but can now walk unassisted thanks to a prosthesis, and hopes to qualify as a technician in early 2015.
When I treat those who have been handicapped, be they upper body or lower body amputees, or those with spinal problems, as a victim of the earthquake myself, it gives me the courage to help them. It brings it right back to me.
Thousands of people lost limbs in the earthquake, which left more than 1 million Haitians homeless. The program has helped more than 100 young quake victims become fitted with limbs, and hundreds more will begin treatment in the coming weeks and months.
When the quake happened, there were only around a dozen trained amputee specialists in the country. If these students pass their exams, They'll be helping to make Haiti less dependent on outside expertise for those still affected by the events of January 2010.